80% of patients with psychosis experience significant difficulties with cognition. For patients, this is a very important aspect of their condition. Cognition has been rated in the top 5 most important outcomes for people with a lived experience of psychosis, above that of hospitalisation. Previous work has shown that cognition is not very well assessed in patients with psychosis. This might be because full cognitive assessments are time-consuming and expensive. Studies have tried to assess related measures which require less time and financial resources. But another strategy could be that we could try to get patients to complete tasks on their phones outside of clinic. However, there may be many barriers to this approach. My work looks at developing smartphone cognitive screening tests to see if we can improve the availability of these tests for patients. In my PhD, kindly funded by Mental Health Research UK, we will assess if stakeholders, that's healthcare professionals and service managers, see a need for cognitive assessments in the patient group. We will look to validate an application which supports a cognitive tester's processing speed. In this study, we are also interested in whether the location of a test impacts the results that you get from that test. This application has had extensive input from people with lived experience. We will assess the feasibility of performing these tests in a large cohort study assessing patients with psychosis. We will look at multiple aspects of feasibility, such as acceptability, and whether patients engage well with these assessments. This work will inform how we can implement these assessments into NHS clinical care. It can tell us about how we can combat factors which may lead to poor uptake of these assessments. We hope that this work will help widen NHS patients' access to cognitive testing, improving their care.